Very good evening, all of you, all the doctors and all other medical staff here. On behalf of Indian Medical Association, Ananthapuram, we are cordially inviting you a webinar on stress management for medical professionals and all those who are involving in the COVID duties or in during these COVID days and lockdown. First of all, I invite today's speaker all the way from Guntur, Dr. Kota Suresh Kumar Garu is a professor and HOD of Psychiatry, Katuri Medical College, Guntur. And I invite Dr. M. Sreenivasulu Garu, MSc, retired professor and ex-IMA President. And I invite Dr. Yendluri Prabhakar Garu, professor and HOD of Psychiatry, Indian Medical Association, Ananthapuram. And myself, Dr. G. Bhanumurthy, MS Ophthalmology, General Secretary, Indian Medical Association, Ananthapuram. And I also inviting Dr. G. Hemalatha, MBBS DCH, Treasurer, Indian Medical Association, Ananthapuram. And each and everyone on this side, I heartily welcome you on this webinar. Make it grand success. Over to Yendluri Prabhakar.
Thank you, Dr. Bhanu. So I request our Chairperson, Dr. Sreenivasulu sir, kindly introduce the topic.
Thank you very much. This is a very appropriate time to conduct this webinar on stress management for health personnel. So the commonest disabling mental health issue experienced by personnel in the front line of any pandemic is burnout. So a triad of emotional exhaustion, depersonalization, that is a lack of empathy, caring and compassion, and decreased sense of accomplishment. So all these should be addressed in this webinar. So burnout can have a significant impact on the competence and can impact healthcare delivery. So I congratulate Dr. Prabhakar and his team, dynamic team, and I request that Kota Suresh Garu to take over. Start the webinar.
Just wait, sir. But I need to introduce the speaker. I need to introduce the speaker.
Yes.
మానసిక వైద్య రంగంలో డాక్టర్ కోటా సురేష్ కుమార్ గారు తెలియని వారంటూ ఉండరు. మానసిక వైద్య శాస్త్రంలో అనేక మైలురాళ్లను చేరుకున్న సైకియాట్రీ లెజెండ్ ఆయన. అంతర్జాతీయ జర్నల్స్ తో అద్వితీయమైన ఖ్యాతిని సంపాదించుకున్న మన కదిరి ముద్దబిడ్డ, కరువు జిల్లా అనంత మట్టిదారుల్లో మెరిసిన మానసిక వైద్య గారు, వృత్తినే దైవంగా భావించే అపారమైన పాలన అనుభవజ్ఞులు, మనుషులకే వారి మనసులకు ఆత్మీయమైన చికిత్స చేయగల మనసున్న డాక్టర్, ప్రతిభ, మానవత కలగలిసిన వ్యక్తిత్వ సంపన్నులు, తెలుగు ఆంగ్ల భాషల్లో అద్భుతమైన కవిత్వం రాస్తున్న వాస్తవిక కవితా సారథి, అక్షర నిధి, స్వయం కృషితో ఎదిగి ఫోరెన్సిక్ మెడిసిన్ లో బంగారు పథకం సాధించ, నేటి వెబినార్ లో ఎన్నో అమూల్యమైన విషయాలను మనకు వివరించేందుకు ప్రధానంగా విచ్చేసిన ప్రముఖ మానసిక వైద్య నిపుణులు, మృదు స్వభావి, మానసిక శాస్త్ర మేధావి, గుంటూరు కాటూరు మెడికల్ కాలేజీ సైకియాట్రీ విభాగం అధ్యక్షులు, మనందరి ఆత్మీయులు ఆత్మీయంగా స్వాగతం పలుకుతూ ఈ తదుపరి కార్యక్రమాన్ని కొనసాగించవలసిందిగా కోరుకుంటున్నాను. ఓవర్ టు డాక్టర్ కోట సార్.
Thank you, sir. Thank you very much. My namaskarams to everybody. And Prabhakar garu, as usual, అతిశయోక్తులు ఎక్కువ. Anyway, thank you. Of course, I'm very happy that I'm being associated with the young dynamic executive committee of Ananthapur, which was selected only a few weeks back. And I'm very happy that in the initial program I have been invited as a chief guest. అందులో అనంతపూర్ అంటే ఒక అవినాభావ సంబంధం ఉంది. ఎందుకంటే ఇందాకే చెప్పారు ప్రభాకర్ గారు, మా నాన్నగారు కేజీకే గుప్తా గారు కదిరి గ్రామంలో జన్మించారు. మా మదర్ పొద్దుటూరు కడప డిస్ట్రిక్ట్లో జన్మించారు. నేను ఉరవకొండలో పెళ్లి చేసుకున్నాను. సో 3 రాయలసీమకి సంబంధించినవే. చదువేమో కాకినాడ, ఇక సెటిల్మెంట్ ఏమో కోస్టల్ డిస్ట్రిక్ట్ గుంటూరు. సో అన్ని జిల్లాలు మనకి కావాల్సినవి. ఎలాగైనా బ్యాక్వర్డ్ డిస్ట్రిక్ట్స్ మనుషులు చాలా ప్రేమగా ఉంటారు, అది అందరం గమనిస్తాం. ఈవెన్ గుంటూరులో కూడా పల్నాడు బెల్ట్ అనేటప్పటికీ పల్నాడు బెల్ట్ పీపుల్ చాలా ప్రేమగా పలకరిస్తారు. రాయలసీమ అనగానే చాలామందికి ప్రజల్లో సుమోలు, బ్లాస్ట్లు గురించి ఆలోచన తప్ప ఇంకోటి ఉండదు. సినిమాలు అంతగా పాడు చేశాయి. కానీ అనుబంధంగా ప్రతి ఒక్కరిని అన్న, అక్క అని ఆత్మీయంగా పిలిచేది రాయలసీమ జనాలే. ఆ విధంగా చాలా ఇష్టమైన ప్రదేశం నాకు. తక్కువ సార్లు వచ్చిన, ఇదివరకు కూడా ఒక దశాబ్దం కిందట ప్రభాకర్ గారు పిలవటం జరిగింది. విజయ్ కుమార్ గారు కూడా ఒకసారి వాళ్ళ హాస్పిటల్ ఇనాగ్రేషన్ టైంలో వెళ్ళటం జరిగింది. ఇంకా ఇవాళ టాపిక్ వస్తే స్ట్రెస్ మేనేజ్మెంట్ చాలా అందరికీ అవసరమైనది, ప్రతి ప్రొఫెషన్లోనూ అవసరమైనది. ఇందాక శ్రీనివాస్ గారు చెప్పినట్టు ఈ కరోనా వచ్చిన తర్వాత ప్రతి ఒక్కరికి అది చాలా అత్యవసరం అయిపోయింది. ఈవెన్ యాజ్ అ సైకాట్రిస్ట్గా ఉన్న కొద్దిగా దగ్గు వచ్చినా నాకే భయం వేస్తుంది, నిజంగా ఇవాళ కరోనా అటాక్ అయిందా ఏంటి అని. అలా జనాలు చాలామంది రోజు ఒక 3-4 కరోనా ఫోబియా అని అంటాం, ఆ రకమైన ఫోబియాతో అఫెక్ట్ అవుతున్నారు. సో అండ్ మెయిన్గా మన ప్రొఫెషన్లో చాలామంది ఫ్రంట్ వారియర్స్, ఎస్పెషలీ ఈఎన్టీ సర్జన్స్, పల్మనాలజిస్టులు, వాళ్ళు మెయిన్గా ముందర ఉండి చేస్తున్నారు. వాళ్ళందరికీ నా నమస్సుమాంజలు. ఇక టాపిక్కి వస్తే మన స్ట్రెస్ మేనేజ్మెంట్. పుట్టిన ప్రతి శిశువు స్ట్రెస్ పుట్టినప్పటి నుంచి ఈ స్ట్రెస్ అన్నది ఉండేదే. కాబట్టి స్ట్రెస్ ఎలా ఎదుర్కోవాలి అన్నది మనం మెయిన్గా చూస్తే, ఈ స్ట్రెస్ అసలు ఎందుకు వస్తుంది, వాట్ ఈస్ ద కాజ్ ఆఫ్ స్ట్రెస్, ఈజ్ ఆల్ స్ట్రెస్ బ్యాడ్? నో, బట్ ఇఫ్ యూ కమ్ దట్ వే, ది స్ట్రెస్ ఈజ్ మెయిన్లీ, there are 2 types of stress, good and bad. And mainly when we are talking, we talk about stress on which is causing a lot of problems. So delivering a lecture for professional colleagues is a stress for me, and hearing this lecture could be even more stressful for you. If you have cut off your videos, I might not see picture like this, but I hope you people are not in this situation. There are a lot of definitions of stress when we go through, and at least 1 lakh definitions are there on stress in Google. But simple definition is an imbalance between demands and resources. So our coping mechanisms are less, or the demands which are put on us are very high. That leads to a gap, and that gap leads to stress. And pressure exceeds one's perceived ability to cope with, and any circumstances that can threaten or perceived to threaten one's well-being, and thereby taxing on one's coping abilities. This is what we can say as a stress. And generally our response to stress, all doctors know, emotional responses. Under stress, people react emotionally. Usually unpleasant emotions are elicited rather than the pleasant ones. And common emotional responses are annoyance, anger, rage, apprehension, anxiety, fear, dejection, sadness, and grief. These are the usual negative responses which we come across. And generally either we have to fight with it or run away from it, that is flight. So fight or flight response, the autonomic system mobilizes organism for fighting or fleeing to threat. And general adaptation syndrome, the Seyle who has discovered this, alarm, resistance, fighting with it, and finally exhaustion. And there are a lot of pathways. Mainly the most important pathways in the brain which are related to the stress are autonomic nervous system, hypothalamus, and immune system. And the physiology of stress, as you can see, stress perception occurs in the neocortex of the brain, and it is transmitted to hypothalamus, then to hypothalamo-pituitary cortical axis, and finally the cortisol is secreted excessively, which leads to fight or flight response. And is all stress bad? No. There is what we call good stress or eustress. Up to some level, up to one Lakshmana Rekha, stress is good because it motivates us. Suppose student has an exam a month after, he will cut off all the things and focus on his educational activities. Or we have some program which we have to deliver, then we cut off and then we motivate ourselves. So it's a good thing. It motivates us. It brings us our performance to a better level, but up to some extent. But as you can see, once the stressor is more, then it leads to distress, where the performance which comes down, actual performance slowly comes down, you become exhausted, then find ill health, and finally breakdown. That's what happens with bad stress, where when it is severe, we have to face. And what does chronic person facing stress continuously? Sympathetic nervous system is stimulated and parasympathetic nervous system is under working, that is depressed. So the blood pressure, pulse rate, all these things increase. And inflammatory cytokinins are released and negative feedback mechanism is lost, and dopamine and serotonergic pathways are much affected. So by sympathetic nervous system overstimulation, the person leads to what we call as cardiac problems and other type of disorders, lifestyle disorders. And that's why stress results in a worsening of diabetes, worsening of hypertension and cardiac problems. As you can see in this slide, the chronic stress leads to psychological problems like restlessness, weakness, inability to work, unable to concentrate, depression, sleeplessness, and sometimes irritability, aggressive behavior, and inability to control emotions, which can lead to physical diseases like cardiovascular system related complications, neuropsychiatric disorders, gastrointestinal disorders, and diabetes and other systemic disorders. Alcoholism, drug abuse, smoking, and adjustment disorders are quite common in people who undergo severe stress. In fact, they try alcohol and drug as an anti-stress. Initially, they would like to experiment with nicotine and drugs and alcohol, thinking that they become stress will be minimal. But the stress is severe and this is a bad coping mechanism. Initially, it might give you a temporary relief, but finally it worsens the situation. So how does our professional people undergo stress? In fact, from intermediate or these days even from 8th class, we are people are getting severe stress because of the severe stress at the education. So the inter-BPC student has to be a bookworm and continuously read, and the parents focus only on how he studies, how he gets the rank, and also the educational institutes, especially the private educational institutes, face lo- face make the students face lot of stress with the daily exams, weekly exams, marks, and other things, which make the student to face the stress severely. And they either present with lot of psychosomatic problems like headache, decreased vision, and people go and check up the neurologist, ophthalmologist, and finally land with psychiatrists once they are ruled out. And that is cause of stress. And we see every time during April, May, when the results are out of the MSET or NEET exams, at least even before examination results are announced, few students are so stressed, they might even commit suicide. Every year we see about at least 5 to 6 patients students who have completed successful suicide. That is very tragic. And then of course they go for a short term after intermediate, then MSET or NEET, and finally few people success, but majority failure, then they go for again long term, and the vicious cycle repeats. So for them, all the things is becoming a doctor. Okay, you have a good idea, you want to serve people, your ambition is to become a doctor, that's fine. But just because you are not interested, but still parents want it, or because of monetary purpose, or for some other reason that there is a prestige in the society, people selecting this and trying repeatedly leads to lot of stress in the students. This is how the stages to become a doctor. As you can see in the school days, they are at least comfortable, and later MBBS, and then PG, and finally super specialty. And this is what the Superman is saying, who are you? And the medical student says, I am a medical student who has won over the Superman. And medical studying medicine, generally 1 year before exam, price textbook of medicine, 6 months before exam, synopsis of medicine, 3 months before exam, short guide to medicine, 1 month before exam, senior notes, and 1 day before exams, Hanuman Chalisa. This is what is happening because they're so stressed and they think only exam is the final thing that is going to create. They feel it's something like a devil or we have to fight with it. So we all have gone through these stages. Studying by the doctor never ends, continuous medical education till the death. And this is the atlas of a medical student brain. As you can see the centers: take exam, worrying center, consider sleep, study mode, then sleep, eat, frustration, attending classes, and think about studying because they can't concentrate with the stress. Finally, you have passed 24 exams to become a doctor. Are you happy now? No. Now prepare for PG entrance exam. So this is a vicious circle, and it goes on continuously. And this is where poor MBBS student who has to face 24 exams total, and passing out during our era, passing medicine, surgery, gynec at single attempt, only 30 to 40% people could do it. Though now it has become around 90%. This is the frustrated MBBS student. You can see the how severe stress they are facing.
MBBS అంటే మెడిసిన్ చదవడం అంటే మెడిటేషన్ చేసినంత ఈజీగా అర్థమవుతుందా? కళ్ళు మూసుకొని తెచ్చే లోపల అయిపోనీకి 4.5 సంవత్సరాలు 14 సబ్జెక్టులు, డిఫరెంట్ పేపర్లు, ల్యాబ్లు, అనటమీ క్లాసులు, మళ్ళీ దీన్ని లెక్క వాడుకునే ఆ బుక్స్. సంవత్సరానికి ఒక్కొక్క సబ్జెక్ట్ ఒక్కొక్క సినిమా చూపిస్తారు తెలుసా మాకు. ఫస్ట్ ఇయర్ ఏమో అనటమీ అని చెప్పి వాల్యూమ్ 1, వాల్యూమ్ 2, వాల్యూమ్ 3 అది నా నెత్తి మీద ఉన్న వాల్యూమ్ పోయింది. సెకండ్ ఇయర్ ఏమో పాథాలజీ, థర్డ్ ఇయర్ ఎస్పీఎం, ఫోర్త్ ఇయర్ బిలియన్ లవ్స్. ఒకసారి చూడ బుక్ ఎంత ఉందో, దాన్ని చూసే జిమ్ లో ఉన్న డబ్బుల్సే గుర్తుకొస్తాయి. సినిమాలో చేతుల మీద బొమ్మలు వేసి ఎక్స్ప్లెయిన్ చేస్తే అంత ఈజీ కాదమ్మా ఈ ఎంబీబీఎస్. అసలు ఇవన్నీ చదివి ఇంకా డాక్టర్లు అయిపోయినా మన ఫీజు తోటి ఇంటికి వెళ్తే ఇంటర్న్షిప్ ఒకటి, అసలు ఇంటర్న్షిప్ తోటి ఇంకొక పంచాయతీ. అరే మొన్నదినదే గుర్తుకున్నదంటే 4 సంవత్సరాలు చదివింది ఏం గుర్తుకుంటుంది చెప్పు. ఇంకొంతమంది పేషెంట్ వాళ్ళు తెల్లకోట వేసుకున్న ప్రతి ఓళ్ళు సిస్టర్ అని ఫీల్ అయిపోతారు. పాపం వాళ్ళకి సిస్టర్ ఎవరో డాక్టర్ ఎవరో తెలియదు. ఇంకా కొంతమంది పేషెంట్లు పెద్ద సార్ అని వాళ్ళతోనే మాట్లాడతామంటారు. ఈ పేషెంట్లు అందుకలేమో ఇలా పైన ఓరలేమో అప్పుడప్పుడు అనిపిస్తుంది ఇంత చదివినందుకు పేషెంట్ నోట్లో ఒక మెడిసిన్ వేస్తే చాలని చెప్పి. వాట్సాప్ కాన్వర్సేషన్ చేయాల్సిన వయసులో పేషెంట్ అబ్జర్వేషన్. సినిమాకి వెళ్ళి సీటీ కొట్టాల్సింది పోయి హాస్పిటల్లో వార్డు చుట్టూ తిరగాలి. అరే ఇదంతా పక్కన పెట్టే దోస్తులు ఇంకా చుట్టాలు అందరు ఆ దావత్కి రా ఈ దావత్కి రా, మాకు దుంకులాడాలని ఉండరా, కానీ ఇక్కడ కూర్చొని పేషెంట్ ఎందుకు గగుతుండు ఎందుకు తుమ్ముతుండు అని చెప్పి రిపోర్ట్లు రాసుకుంటూ కూర్చోాలి మేము. ఇక్కడ ఇదంతా ఒక ఎత్తు అయితే ఇక ఎవరైనా డాక్టర్ చదువుకుంటే వాళ్ళ ఇంట్లో లేనిపోని రోగాలన్నీ వస్తాయి. బిడ్డ నొప్పి నొప్పి అని చెప్పి ఇంకో పరిశాన్. అది నా ఫ్రెండ్ ఒకటి ఉంటది, అది ఎంపీసీ చేసింది, నేను బైపీసీ చేసిన, అది బీటెక్ చేసింది, నేను ఎంబీబీఎస్ చేసిన, అది పీజీ చేసింది, నేను చదువుకుంటూనే ఉన్నా, అది పెళ్లి చేసుకుంది, నేను చదువుకుంటూనే ఉన్నా. ఇక దాని పిల్లోడికి ట్రీట్మెంట్ చేస్తేనేమో నేను నాకు కూడా తెలియదు. అట్లుంది ఇప్పుడు పరిస్థితి. మీకేమో వీకెండ్ సెలబ్రేషన్స్, మాకేమో వీకెండ్ అబ్జర్వేషన్స్, చుట్టాల నుండి హై ఎక్స్పెక్టేషన్స్. టోటల్ గా నా మీద నాకే కన్ఫ్యూజన్. మరి ఇంత కన్ఫ్యూజన్ ఉన్నప్పుడు వదిలేయచ్చు కదా, ఇది మా ప్యాషన్. 10 తర్వాత నేను కూడా నీ లెక్క ఎంపీసీ తీసుకొని బీటెక్ చేసి సాఫ్ట్వేర్ జాబ్ చేయొచ్చు, కానీ అది కాదు. ఇన్ని సంవత్సరాలు ఇన్ని తిప్పలు పడి డాక్టర్ అయ్యే మజానే వేరు. అదొక ఎంబీబీఎస్ స్టూడెంట్ కి మాత్రమే తెలుసు అందులో ఉన్న హ్యాపీనెస్ ఏందో. దగ్గరగా ఒక 8 సంవత్సరాలు మేము త్యాగం చేసి ఒక మనిషికి ప్రాణం పోసే పనే మాది. నీకే దగ్గొచ్చినా తుమ్మొచ్చినా కావాల్సింది ఈ డాక్టరే.
So that's what, in spite of so many difficulties, still we prefer our profession. At the end, that model says there is nothing to beat our profession in spite of the stress. Once we treat the patient, we are very happy. As a medico, you are treated as a king at home and by society. But after passing the exam, you are a poor doctor. If you are not preparing for your PG exam, one alternative is do practice with your MBBS and catch the flies. Everybody puts the finger in the pie. From RMP to medical shop fellow person, everybody comments about the treatment. While alternate two is join a job in a corporate hospital. BAMS, physiotherapists and BHMS will be competing with you, and they are given preference over you as they are ready to work for peanuts. So you ask for pocket money for the PG exam, and your father's response is like this. And your younger brother or sister who is a non-medical graduate says, "Don't worry, brother, I will lend you some money or even donate money." And your response is putting pepper into the wound. And while non-medical graduate is enjoying his life, at the age of 30 plus, the doctor found her and says, Mummy, I found her, I'll marry. And as a specialist, you can see how much years you have to study. After intermediate or 12th, your age is 17. Long term, 1 year. MBBS, 5 years. Internship, 1 year. PG entrance, 1 year. Course, 3 years. Super specialty preparation, 1 year. Super specialty course, 3 years. Compulsory ruralship internship, 1 year. Total 16 years. That is, by the time you complete and become a specialist, it will be 31 to 35 years. And by the time you enter the profession, you are like this, quite dynamic, charming, young. And by the time you complete your PG, you are like this. And this is medicos on graduation day. Medical students who have completed their medicine on graduation day, taking a selfie. But still, we prefer our profession. In spite of all this stress, our goal, our aim is to bring happiness to the sick people, and the regard which they pay cannot be measured in monetary way. Definitely money is needed for everybody, but we get money as well as regard from the patient who has been treated. And from sickness to happiness, doctor is the medium, and that brings us happiness, that brings us the energy and motivation to face the stress. But what has happened? Though initially we had a lot of position in the society, changes in the society has peeped into the profession. After especially the Consumer Act, patient has become consumer, doctor has become a service provider, corporatization of the medical field, and few black sheep in the profession. In fact, in every profession there are some black sheep, but at least in our profession there are very few. But still, one person is enough to bring bad name to the profession. And who is responsible for all this? Ourselves, professional jousting, society, advertisements like guarantee treatment. You see that we give 100% guarantee, which no doctor can give. And patients over expectations because of lot of investigation facilities, advertisements saying that we have brought the latest medical wonder which can cure you, which can diagnose you. And I was hearing an advertisement in the city cable. We have latest facilities and a lady doctor, as if lady doctor is a facility. That's what the city cable TV advertisement which I was hearing. Another problem which we come across mainly is we are excellent clinicians, but we have poor skills in communication. That is what is bringing a lot of problems. Few years back at Guntur, I was president of IMA, and we formed a team, a rescue team, action team, where whenever there is a problem by the patients or patient relatives, if they are doing damage to the hospital, we used to go there and try to solve the problem. The moment 6 or 7 people go there, people's anxiety, worries come down, and one of the person who is creating a problem might be known to us, and we can say the doctor is a nice fellow, there must have been some misunderstanding. And majority of cases, the misunderstanding is not because they have not done proper treatment. Majority, 90 or even 99% of the doctors treat with good intent and do well, good treatment. But their communication is quite poor. And because of the excess work and long hours, they might suddenly lose their emotional balance and shout at the patient relative, and who would remember that and criticize if there is something negative things happen. And if suppose a doctor patient asks a second opinion, definitely he can be sent for it. There is nothing wrong. Some doctors might feel bad when second opinion is seeked. Definitely it would also help us, because majority times 99% we are correct. So even on the second opinion, the doctor would favor us, and they would believe that we have given them a correct diagnosis and treatment. So these are the slides which I have put for poor communication skills. The doctor will see you now, the nurse saying, but I can't promise that he will talk to you, but he will see you. That means he just sees him, immediately sends him off. You just have to have not only hearing, talk to him for a few minutes. That is minimum expected from a doctor. That's what I was saying. The communication skills are poor among the doctors, which is resulting in bitterness between the doctor and the patient, which in turn is resulting in stress among the doctors. That's why even Medical Council of India has now changed the curriculum for the doctors. Because I am in the medical education team member of Katuri Medical College. Now whole medical, the entire health university has given a medical curriculum based on MCI, and that medical curriculum initially teaches communication skills. They also teach how to talk with the patient. They send the person to the village and see the environment, how it is. So from the beginning itself, the person, the medical student is exposed to all the things, not only to the theory, but practically they are exposed. They are taken to the primary health center. They are shown to the doctor, introduced to the doctor. They see the what complaints they have, the patients have, and how they are being dealt. All these things are there now in the medical curriculum in the first year itself, suggesting the communication skills being imparted. Do doctors need communication? Definitely. There is no doubt about that. Doctors need to learn essentials of good communication more than other professionals, because patients are humans with sensitive needs. Doctors cannot practice medicine without effective communication skills. Poor communication is the major cause of medico legal problems and ethical problems. So this is the famous quotation from William Osler: listen to the patient. He is telling you the diagnosis. Because there have been some studies which have shown that the doctor interrupts the patient when he is taking the history within 35 seconds after patient starts talking. So we are not allowing the patient to come out with his complaints completely, and we are not hearing much. That is because of overload of work, whatever it is, but we cannot excuse, it cannot be an excuse, because you have to hear the patient. And as Osler says, 80% of the diagnosis can be made just by mere history. And another problem which for stressors for medical profession is professional jousting. Jousting has been defined as unfortunate practice of one healthcare professional making critical or derogatory comments about another provider, either to the patient or relatives, without having reviewed the records, without discussing his or concerns with the previous physician. The moment the patient has come to him, they are commented This is the word that has been used by Professor V. Sharma, President of Indian Association of Medico-Legal Experts. This professional jousting is responsible for half of the stressors which we are facing. It's not the patient. If the patient has filed a case, or patient has complained, or patient or relative has misbehaved, at least in 50% of cases, there is another doctor behind these incidents. So you might think that you are accusing the other professional colleague, but tomorrow you are going to face the same thing. So we should be united, and this professional jousting should be avoided at all costs. For examples of professional jousting, which I have come across, one doctor commenting on the other doctor. The moment you go, majority of the people say, oh, that doctor, he doesn't know anything. So once you are raising an index finger towards somebody, four fingers are pointing towards you. Tomorrow somebody will do the same thing. If really the doctor has committed mistake, if the doctor has really committed a gross negligence, definitely you can talk to him, say that these are the things you have missed. But commenting in front of the patient and relative badly about your colleague is in no way advisable, no way permissible. Then second question which generally they say is, why did you go to the doctor? In fact, there was one neurosurgeon whom I was referring cases whenever I had a doubt that there might be some organic problem. And the first comment he was making was, why did you go to that psychiatrist? Why did you go to that mental doctor at all? So that type of bad wording should not be there. It should be avoided. And of course, senior people, professors like me, commenting about juniors. Oh, he is my student. He failed so many times. Finally, I passed him. This is what they would say to the patient and relatives. That leads to a lot of bad blood, and that leads to trouble, and that patient and relatives goes back to the first doctor and comment against him or fight against him or abuse because of these things. So we should always speak courteous about our colleagues, and don't skip the word. Once the word comes away from your mouth, we can't take it back. Be careful with your words when you're commenting about other colleagues, and don't comment in front of the patient or relative. You can, as I said, you can talk to your group friends. You can tell them, don't do this. You're missing these things. That will help them also to update their knowledge. And these days we are having another problem, net savvy patients, internet, which has changed the world, the global village. Everything has become net savvy, people reading net, coming out with the things. Dr. C.N. Manjunath said, idiot, IDIOT syndrome is a huge hurdle for doctors in urban areas. That is, I standing for internet derived information obstructing treatment. So I, internet, D for derived, another I for information, O for obstructing, and T for treatment, idiot, which we largely see in urban areas. Because they just Google, and Google is not a Bible or is not a medical standard book which they don't understand. Anybody can edit, and Wikipedia self-analysis, self-editing can be done. And so it is not a Bible, but people go follow it and think that they have learned medicine, they know everything. And especially about the side effects, which are the drugs they refer. Yes, definitely the side effects are there with all our drugs, but how much percentage they would go through the things. Suppose a serious side effect would occur in not 1%. That risk has to be taken. That's what I explain to my patients. In the same way, side effects could be only occurring in 1 to 2% of the individuals. Minimal side effects. So we can say to the patient that these are the things. Very rarely something happens. I always give a example saying that you take omeprazole for every gastric problem, and sometimes omeprazole can itself cause severe burning sensation, And paracetamol, everybody takes. Paracetamol is available outside, even in the small shops, not medical shops, even in small petty shops. And that itself, 1 in 1 lakh, can cause gastrointestinal bleeding. That doesn't mean we can't prescribe. In that case, nobody can prescribe a drug. This is what happens with these net-savvy patients and whom we have to explain. One doctor commenting about, jocularly, the patient knows more about their diseases than me. I think I must update, I must get faster modem, higher speed internet access than the patients. And this lady who has had a fracture of the shoulder saying to the doctor, I would like a closed reduction and K-wire fixation under nerve block and light GA. So the doctor's response is, in his mind, I hate internet. So now they are not only making a diagnosis, they are also telling about the treatment. So I think this board explains how to deal with net-savvy patients. OPD charges, my diagnosis, my treatment is rupees 800. My diagnosis, your treatment, rupees 1000. Your Google doubts to be clarified, rupees 1500. Your diagnosis and treatment, rupees 2000. Your diagnosis, your treatment, rupees 5000. So probably this is what we have to do. In fact, jocularly we were remarking that we have to charge this net-savvy patients double or triple. Finally, whenever the patient has a problem, when patient becomes aggrieved, annoyed, there is what we call as ambulance advocates. This is quite popular in West. The moment an emergency van comes to the home to pick up a patient, there is already an advocate behind. So that if something happens, he will tell them, file a case against the doctor. If things are negative, don't worry about the money which you have to pay. Once if you win the case, you can pay me the 50%. Majority of the doctors are there who would, lawyers are there who would instigate the patient and see that their clients get proper money, and in turn they would get the money. So this is the present situation. Patients and doctors, as you can see, if the patient fires the doctor falls down and patient falls down deep in the valley. So finally, the patient is the ultimate loser. 10 years back, I know my colleagues in small towns like Chilkalurpeta, Tenali, Narsaraopet, where they would take a lot of emergency cases and deal with them, explaining the prognosis. But today, majority of them are afraid to deal with these cases. The moment they think it is an emergency or it is a serious case, they are referring the people to higher centers just because of patients' untoward behavior which is expected from them. So they are referring. Finally, the sufferer is the patient. The patient in their hometown, if has been treated by his doctor, family doctor in his village or a small town, the expenditure would have been so minimal. But now being referred to a higher center, naturally in the higher center, the specialist and other things would take all precautions and all investigations and then only treat the patient accordingly. So the patient's society is not understanding this thing. Finally, the consumer or the patient is going to be in soup if things continue this way. Ransacking of the hospital, and the chota mota gully politician or a caste leader enters into the picture. Then he talks on behalf of the patient and relatives, and then take some money, and that is what happening. Again, as an IMA president few years back, we were trying to solve this problem, go and fight with them. We used to say, file a case, don't bother, file a case. When you have done properly, you need not worry. But a lot of doctors are afraid that their name and fame would be burnt, and so they were settling the things out of the court, which was resulting in further type similar complaints against the doctor, which results in severe stress. And finally, the TV person comes with a breaking news telecasted repeatedly about the doctor not taking care, and the patient dying, and the people ransacking the nursing home. And this repeated telecast leads to breaking of doctor's prestige, name, and fame, which has been built over decades. That again is a very severe stress which we have to face. Everybody has to face. In fact, when I started practice 3 decades back, there's one psychiatric patient who was admitted, and 2 days later he was on medication, but he climbed the overhead tank and was threatening that he would jump down, commit suicide. So sister called me at the middle of the night, and I had to go there and see. Until that time, patient was still on the water tank because he was ambivalent. He was suffering from schizophrenia. If he was suffering from depression with suicidal ideas, he would have jumped immediately, and my name and fame would have also jumped down. But luckily, he being a schizophrenic, he was ambivalent. That is, to do or not to do. So he was making 2 steps front and 2 steps back. And finally, some relative and my compounder went back and climbed and took him back. So these type of things every doctor has. I was only giving an example of psychiatry, but a lot of medical emergencies and other things, people have to face the things. And this is the present pathetic situation of doctors. Neither the media is supporting us, neither the government is supporting us, and the government allotment to the health system is very meager. In fact, 1 to 2% or 2 to 3%, that is what the government is allotting for the health sector. That is very meager and pennies, which can't really make for the health of the people. So finally, is this the answer for the code of a doctor, dress code of a doctor? Should we be prepared to face everything? But anyway, these days, finally, I have seen one judgment being given in doctor's favor. There appears to be some light at the end of the tunnel. The man hits doctors over COVID death, and High Court slaps rupees 1 lakh fine. Deposit money in CM fund for pre-arrest bail. That was the court judgment. And hats off to Justice Bharati Dangre of the Bombay High Court, who has imposed a hefty fine on a person claiming to be a social worker who was accused of roughing up the doctors after a COVID patient's death. So once COVID, everybody is afraid. They don't even come nearer. They don't treat. But the COVID warriors go inside near the people, treat them, and negative result is happen. That is not in our hands. But this particular fellow who was a social worker of all the things, and he slapped the doctor, and he had to face the music. Now he is asked to deposit 1 lakh fine, and this fellow apologized to the justice, but the justice said just mere apology is not sufficient. You have to definitely compensate for what you have done. And this 1 lakh, here 25,000 he has asked to deposit initially to get to the bail. Really, I was very happy to see this type of judgment, and I hope this type of justice will be done to all of us. And for the stress which we are facing, why are we facing? Our personality is also partly responsible. We are predominantly type A personality. We have high demands on self and others. We deal with the death and dying, confrontation with physical and emotional sufferings. These are the things that make us a lot of stress. And this is personality type A on the left side, you can see, where the person is always on the go, pressure themselves to do, constantly under stress, highly driven, competitive, impatient, easily angered, hostile, never have enough time, often doing multitasking, more stress and more health problems. These are all type A personality characteristics, and majority of us are type A personality. So we have to adjust and counsel ourselves to things behavior. In spite of doctor knowing that death is inevitable and daily dealing with the death, the doctor also sometimes emotionally gets attached to the treating patient. He must have been treating that particular patient in this intensive care unit or a serious ward where they are kept. After a month, in spite of all the things, if the patient dies, doctor also emotionally feels depressed. Why even psychiatrists, we spend a lot of time in psychotherapy and counseling. Every year we try to bring out the depressed patient from the doldrums by counseling and other things. And sometimes these patients, in spite of our counseling and best efforts and medicines, one or two people would commit suicide, and that would result in lot of emotional turmoil even amongst us. Of course, being seniors, we going across, then we slowly get adapted to these things. తెలుగులో చెప్పాలంటే తామరాకు మీద నీటి బొట్టులాగా we look after things, but we should not get too much detached. What we call as detached attachment or attached detachment is essential. If you become so seriously involved with the patient emotionally, it can result in your getting stress and tension when the person dies. And this is Sunday father. Majority of doctors, male doctors I was mentioning, are called as Sunday fathers. This is because the morning by the time the doctor wakes up, the child goes to the school. And by the time the doctor returns on any other working day, the child is already sleeping 2 hours in deep sleep. So the child gets an opportunity to see his parents, if both are doctors, only on Sunday. And that's why these doctors are called Sunday parents. So we should maintain a perfect balance between family and profession. And that is most important to avoid stress. This is one doctor who has done in a drama. The earlier one, which I have shown you about the medical student, was in Telangana slang. Well, this is from Rayalaseema slang. Just 2 minutes.
ఎప్పటి నుంచి 4 days నుంచి వస్తాను. వాంతులు ఉన్నాయా? కళ్ళు కింద పడిపోయినాను. కింద పడింది ఏమన్నా? కొట్టుకుందా? కళ్ళు ఏమన్నా? ఎక్కడ కొట్టుకుందమ్మా? ఎప్పుడు కొట్టుకుంది? నిన్న మొన్న తీసుకున్నా అంత సీరియస్
హరిప్రసాద్
సిస్టర్ బీపీ అప్డేట్ తీసుకున్నామా? బాబు బీపీ కూడా తక్కువ ఉందమ్మా. వెంటనే ఐసీయూ షిఫ్ట్ చేసి సిస్టర్ కండిషన్ బాగాలేదు. ఎక్స్రే అనేది రాసిస్తాను చేయించండి. బాబు కండిషన్ అయితే ఏం బాగాలేదు. మళ్ళీ మళ్ళీ చెప్తున్నాను. సీరియస్ అవ్వదండి. మీరు చెప్తున్నాను అర్థం చేసుకో. సీరియస్ అంటే సార్ పాప ఆడుతుంది సీరియస్ అంటే తెలీదు. పాప కండిషన్ గురించి చెప్తున్నాను నేను. సీరియస్ అవ్వ తీసుకో. ఐసీయూలో పడుకోబెట్టమ్మా. ఎత్తుకొని పోయి ఐసీయూలో పడుకోబెట్టి బాగా పెద్ద ప్రాబ్లం ఉంది. పేరు కుక్కబడింది. సో దానివల్ల మొత్తం కడుపు అంతా కూడా ఫ్లూయిడ్ చేరుకొని చాలా సీరియస్ గా అవుతా ఉంది. అందుకే బీపీ అన్ని పడిపోయినాయి. ఆ దెబ్బ బలంగా తగిలినట్టు బాబు. కండిషన్ అయితే సీరియస్ గా ఉంది. వెంటనే ఆపరేషన్ చేయాలా? ఎట్లా సీరియస్ ఉంటుంది సార్? నిన్న పాప ఆడుకుంటుంది. ఈ రోజు మీరు కాడికి వస్తారు. సీరియస్ అంటున్నారు ఎట్లా సార్? 3 రోజులు అయితే బాబు దెబ్బ తగిలి 3 రోజుల నుంచి సీరియస్ చేస్తారు. మందులకి ఏదైనా కవర్ చేయండి సార్. సీరియస్ ఆపరేషన్ ఎట్లా సార్? చేయాలి బాబు. ట్రీట్మెంట్ ఏది అవసరమైతే చేయాలి. ఆపరేషన్ అయినా మందులైనా ఏది అవసరమైతే చేయాలా? ఆపరేషన్ వద్దులేదు సార్. ఆపరేషన్ చేస్తేనే క్యూర్ అవుతుంది. లేకపోతే క్యూర్ కాదు. మీరు కావాలంటే వేరే హాస్పిటల్ తీసుకోండి. ఆపరేషన్ తప్పదంటారు. ఆపరేషన్ తప్పదు బాబు. సార్ అయితే ఎలాగైనా మీరే చూడండి. అదే చెప్పినా కదా ఆపరేషన్ చేయాలా అని. చేసినాము. ఆపరేషన్ మనం స్కానింగ్ లో ఊహించిన దానికంటే లోపల డ్యామేజ్ ఎక్కువ ఉంది. అందువల్ల కండిషన్ కొద్దిగా సీరియస్ గానే ఉంటుంది. చూడాలి ఎంత మాత్రం బాగా ఉంటుంది ఏంటనేది చూడాలి. ఎంత సీరియస్ ఉంటుంది సార్? స్కానింగ్ చేసినారు, 10 స్కానింగ్ చేసినారు. స్కానింగ్ లో అన్ని కనపడవు, మనం ఆపరేషన్ డైరెక్ట్ ఆపరేషన్ మాత్రం సీరియస్ ఉన్నట్టే కదా చెప్పినా కదా ముందే కండిషన్ అంత బాగుంటుంది, సీరియస్ అయితే సీరియస్ గానే ఉంటుంది చెప్పినా కదా. ఇది డబ్బుల కోసం కాదు బాబు, ఇక్కడ లోపల ఉన్న దెబ్బలు బట్టి మనం మా బాబుకి ఏదైనా హాని కలిగిందంటే మీరున్నారు, మీ హాస్పిటల్ ఉన్నమాట బాబుకంతా బాగానే అయింది, ఎట్లా దొరకకుండా బతికి బయటపడింది. ఎందుకంటే డిశ్చార్జ్ అంతా ఆడిస్తాను, మందులన్నీ జాగ్రత్తగా వాడుకుంటే సరిపోతుంది. చూడండి
So anyway, luckily the patient was cured after surgery, but if she would have died or something, you can just imagine the way the relatives would behave. So whenever they come in a serious condition, they call us as a god, and when something happens, we become devils. So anyway, as I said, doctor has been torn between family and profession, and work-life balance has to be maintained. Stressors from work overspill to home and vice versa. So never carry your stressors from home to nursing home and from nursing home to your home. Lack of exercise and leisure activities and lack of free time, home demands and disruptions to social life. A perfect balance between work and family is to be there. However busy you might be, you have to maintain a balance and you have to spend time with your family, which will be a stress buster, definitely, both to you and your family also. There's no harm in closing your nursing home for 10 days and going for a outing once in a year or once in 2 years, or once in a month you go for 3 hours for a outside with your family for a day or two. That is most important thing. In fact, my late father, who is a very popular physician, Dr. K.G.K. Gupta, advised when I entered into the profession 2 things. You read every day 1 hour in the night at your convenience, and always attend patient difficulties. And third thing he said was, once in a year you go away from this place for a week or 10 days, get your batteries recharged, which I strictly follow even today. And the frequent stressors which are there according to the Indian Medical Association study, negative characteristics of the patient, like you have seen in the earlier video: administrative hassles, resource crunch, long hours of work, staff conflicts, and lack of positive feedback. And this another study has shown junior doctors experience more stress than senior doctors, probably because they are the persons who are the first entry level patient touch the doctor and talk to the doctor. And female doctors suffer more stress than their male counterparts. This is probably partially understandable because they have to take care of the family as well as the profession. And government doctors faced more stress than private doctors. Probably the 2 reasons are: one, in addition to the government work, they have their own practice, so that leaves them very minimal leisure time. And second thing, you are answerable to your superior in government place, and whatever you want to do, you can't do because of lot of restrictions and bureaucracy. So this results what we call in burnout syndrome among the doctors: emotional exhaustion, sense of lowered personal achievement, depersonalization, depression, irritability, running away from responsibilities, isolation, anger, and self-criticism. Initially, if you make yourself that you're suffering with burnout 1, then it's okay, you can yourself adjust. But in burnout 2, the irritability is very severe, depression will be there, and by stage 3, you need a psychiatrist help to control avoid burnout syndrome. This is the slide which I have kept on doctors and suicide rates from 1973 to 2008, and every year I come across about at least 3 to 4 cases of my colleagues committing suicide because of this severe stress, family conflicts. So we all need stress management techniques from beginning to face this type of stress. The modern lady is busy with, the modern doctor is busy with work and family, both profession as well as the family, bringing up of the children, preparing food, all these things. And I salute all the women doctors because they are behind these things, both successfully dealing the things. And of course, now that Corona has come, which has made us from 6 months or even more from March, initial lockdown, later these patients, we have to treat them. Doctors before Corona and doctors after Corona. Corona has affected doctors' life most. And this is how they wear the kit, the frontline warriors. I just can't imagine. I tried for it for a half an hour. I couldn't put it. Even facial mask, I put it, and facial shield, I put, and see my patients behind the screen. I find a little suffocating. But these people in complete kit, protective kit, even they can't go for toilet. They even wear pads to prevent soiling, and no food, no water, because you have to remove, then again it takes half an hour to remove and wear another set. So really hats off to the frontline warriors of Corona. Really, you are great people. Luckily, as I have crossed 60 years and as I'm a psychiatrist, I have not been kept on these duties. But still, my children, they do these duties, and really, I hats off to you people who are the frontline warriors. This is the Corona warrior who has come in front of the house just seeing his kids. He can't touch them because he might again transmit that problem to the kids and the family. So from outside itself, he is having a talk, and majority of the people have been evacuated from their home. Doctors from apartment think where they are working as a COVID warrior. People saying that because of his working, his apartment people will get it or the neighbors will get it. These things have happened in Guntur. My own postgraduate students have been asked to evacuate. Then I asked them to inform the management, and if it cannot be done, I said I will give you rooms in my hospital. But luckily, the management gave rooms in the hostel for these people. Now, slightly things are better with people getting adjusted, and this Corona positive things. Everybody, the professor of surgery who is very popular in Vizag, he died with Corona. The young dynamic surgeon, surgical postgraduate who joined only 3 months back, he died of Corona. Yeah? Just imagine what is happening. How much value we can give it for those doctors who are working, really great people. And these are the tired Corona warriors facing a lot of stress, no work. But don't worry, be positive. Always your positive outlook is going to help you in the things. Positive outlook by Corona warrior. You can see here how the person singing a song, dancing in the full suit to come out from the stress which he is facing. That is the positive outlook which we should develop. And as I already said, doctors are often perfectionists, self-sacrificing people, high levels of personal drive, altruism, and very difficult for doctors to accept their stress as distress. And because of their narcissism, they love their own personality, and that leads to also problems and barriers. A lot of doctors have a wishful thinking that they will never develop a medical problem. That is very wishful thinking. We are, after all, human beings. Doctors are poor patients due to maladaptive behavior. Whenever a doctor comes for my consultation, I feel very tense because they are poor patients. They won't follow your advice properly. Treat themselves with self medication and never seek a formal medical consultation. And worried about stigmatization by fellow doctors. That is what doctors do. And This is what corridor consultation. Majority of the doctors even don't enter our clinic chamber. They would just talk outside in a corridor about their problem and seek for a treatment. So in these conditions, how do you deal with stress? You have to change the stressor, change the lifestyle, change of thinking, and developing skills to face the thing. So, in the management of stress, you identify the source of stress and look at how you cope with stress, avoid unnecessary stressors, alter the situation, adapt to the stressor, accept the things that you can't change, make time for fun and relaxation, adapt to the healthy lifestyle. Look closely your habits, attitudes, and excuses. Majority of time we throw the problem on somebody, but the problem might be with us, and we are coming out with some excuse. Try to introspect, try to find out what you are doing and how you are blaming the people for your stress. And stress is always temporary, and you accept your responsibility in creating the stress. Make a stress journal. Keep track of the situations where you were stressed earlier. Earlier, what happened when you faced this? How did you deal with it? How did you come out from successfully from it? And what was your response? All these things. Make a note which would be useful for the next things. And as I already mentioned, these are the unhealthy ways of coping with stress: smoking and drinking, overeating or undereating, spending hours in front of the TV, withdrawing from friends and family activities, using medications to relax, sleeping too much or too less, procrastinating. All these things are not to be done. And you avoid the stress if it is possible. If it is not possible, alter the stress, and your reaction should be adapt to the stressor. When it is unavoidable, you adapt to it and accept the stressor. So the thing which was mentioned regarding corona, sahajivanam cheyali, it is essential, it is unavoidable. And spend less time with people who stress you much, and take control of your environment and prepare your to what to do system. Alter the situation, express your feelings, don't bottom up, don't keep your feelings inside. Share with a good friend. Share with a good friend who wants your betterment, not with a person who is going to tom to all other people that you are having this problem. Be assertive, say no. How to say no is also a art, without harming other person, without making the other person feel sorry. If you cannot do it, say because of I am overwhelmed with things today, so I cannot do today. After a few days, I might do it. Then reframe your problem. If you can't stressor, change yourself. Focus on the positive side. Adjust your attitude. This is how we have to adapt to this stressor. So there is no question, we have to adapt to the stressor. So make time for fun and relaxation. Go for a walk, spend time in nature, call a good friend, sweat out tension with a good workout, take a long bath, light scented candle, enjoy a warm cup of coffee, play with a pet, work in your garden, get a massage, read a good book, listen to music, watch a comedy, exercise regularly, eat a healthy diet, reduce caffeine and sugar, avoid alcohol, cigarette and drugs, get enough sleep. If you do all these things, you don't have time to do anything, even your profession. What you have to do is you choose one or two of what you can do and do it. Train to relax yourself. Take a deep breath and relax. Leave it slowly. Concentrate on some other thing, positive things, imagery. Think of positive things that has happened in life. Avoid cigarette, alcohol, and drugs. Keep busy at work. Increase your self-confidence. This is what motivational speakers' favorite slide. You yourself seeing the cat seeing in the mirror, feeling its lion. That's how your self-confidence has to be increased. Engage in social service. We are lucky that we can do social service in our profession without monetary things. Other person might have to contribute monetarily, but we can do social service. And you develop some hobbies, as Professor Prabhakar, President, has said. This is my 100-kilometer cycling, which I did after 60 years of age with a medal. And this is I was playing a role in a drama. All these things are just to discharge our tension, not that we are going to be actors or cyclists, experts or Olympic winners. It is one way of discharging our tensions. And do not, never go to a shell. Communicate, share with your friends, share with your elders, and music can do wonders. And whenever you are down, think of positive things that has happened in your life. I have been declared lottery winner 5 times to the tune of multiple $1 million in the internet, and 10 banks are competing among themselves to give me loans. Every day I receive a call from HDFC or ICIC, which all of you must be receiving, saying that we are going to give loan without any putting the property. And humor is the best SR. Cut jokes on yourself, cut jokes on colleagues, cut jokes on your profession, but never cut jokes on somebody's disability. Give a smile, even if it is a plastic smile, even if you bring out a smile without reason, that gives a positive thing. And inside the dopamine is secreted. And smile when you are happy, it's actually a two-way. Smile makes you happy, and happiness makes you to smile. And face stress head on. Don't avoid stress. Avoiding stress, procrastinating is not the correct procedure. Face it head on. Instead of letting yourself getting overwhelmed, try to tackle the stress in your own way. Give a compliment to your colleagues. A positive feedback always helps you. You have done well. When you think that your nurse has cooperated your busy schedule, she has been good, give her a compliment. Compliment, just a verbal compliment, which would give her boost, and that is very important. And don't hold a grudge. There might be some problems from people, but never hold a grudge. Forgiveness is a powerful tool, and that is going to help. And if you hold grudges, it results in a lot of stress. Think before you talk, very important thing. Take some time, few minutes or a few seconds even, which will make you not to pass the comment without thinking of the consequences. Never mix work and family. Did you ever, in spite of all this stress and strain, I ask a lot of people, did you ever think that your choice of becoming a doctor was wrong? And 99% of the people said, no, never. But still, in spite of all this, I am proud of being a doctor. From illness to wellness, I remove your tears, I remove your fears. Why worry, my dear, when I am near? That regard in your mind is the best reward than any other award. The erratic food habits, curses of family members are worth facing. Do you see your face with a smile? I will walk with you any mile. I thank Almighty for making me a doctor. I want to become a doctor in my birth. If in any birth, if there is a rebirth, it is worth than any wealth. And can anyone forget the first closure of the abdomen, the first delivery, the patient recovering from serious condition following your treatment? They are more better dopamine stimulators than the first kiss and first puff. And the patient letter, which motivates us. This was one letter which I received from a patient on the doctor's day. I owe you to your caring ways, skillful hands, golden heart. You gave me the strength to keep going when I felt I could not. I am so blessed and happy that you are my doctor. These type of positive feedbacks are what we are happy. That's how our stress is removed. These things make us very happy. Just because some stress are, we need not avoid becoming medical doctor. There might be a lot of jokes on us, there might be things, but still these are the things which gives us positive feedback, and that is going to help in removing the stress. And I thank everybody for the patient hearing in spite of my talk exceeding around 15 minutes. I thank everybody, and I thank IMA executive, especially Professor Prabhakar. The world always looked brighter from behind a smile, so smile always. Nothing to lose. Thank you very much. Thank you.
Thank you, sir. Thank you very much for the extensive and very useful presentation.
Thank you, sir.
So there, somebody asking some questions. There is
Sure.
one question in chat box. So, what's the role of sports activities in our daily profession for stress relief?
Definitely, the role of sports have been proved that they are very useful for the relieving stress, and mild to moderate only. Mild to moderate exercise, whatever it could be, workout, cycling, walking, it should be mild to moderate, which increases the dopamine levels. It has been proved scientifically, it stimulates dopamine, and the increased dopamine and serotonin are going to be the helpful in dealing with the stress. And only thing is exercise, all these things few hours before sleep should be avoided, because moderate exercise makes them having insomnia. So severe exercise before sleep, at least 2 to 3 hours before sleep, is not advised. But otherwise, definitely sports, whatever type of sports, is definitely going to help to keep physically fit as well as psychologically fit.
Thank you, sir. Sir, no other questions, but I want to ask one question on behalf of unmarried doctors, especially this house surgeons and
Sir, welcome, sir.
some students are usually they are asking one question. Sir, getting married, regarding marriage, so is it a profession or non-medical?
Getting married to a medical or non-medical
person for getting marriage. So, which is better regarding stress?
I think it all depends upon the individual person. You can't generalize. Of course, I am married to a non-medical person and I am very happy. And the other side, I don't know unless I marry a doctor at this age. Anyway, I was just joking. But anyway, I think it all depends upon the individual person. If you are able to respect the better off, you are thinking of helping her in the work, because as I already put, the lady doctor, she is always busy with her professional and personal work. So once you come out from your hospital and put all the work on that lady doctor, then it will lead to lot of stress. You should always be ready to share the family work also if you are preferring to marry a lady doctor. Definitely, professionally, it would be useful because of the work you can share, because of the income that is generated. That way, there are some advantages, and also bringing up the family would be more beneficial. But all depends upon the individual person. I'll give an example. When I was doing work my diploma at NIMHANS, my aunt and uncle who were ophthalmologists and gynecologists, their children were 3 children, and they were studying the 10th and intermediate, and they were eating food that is prepared and kept in the fridge last week, and they didn't have much time to spend with their parents, and they were always saying, we will never marry a doctor. And all 3 of them, mind you, have married doctors. So once they have grown up, things have changed. But professionally, I think marrying a person in the same profession would be partially advisable. But if all members are doctors, again, the whole discussion in the family, at the dining table, at the TV place, will go on discussing about the patient. Then e-patient usanu, then e-patient usanu. So no other things will be discussed. So always, as every issue has pros and cons, this issue has also pros and cons, and it always depends upon how the particular person wants it. I don't think we can generalize and say, marry a doctor, don't marry a doctor. That we can never say. That is my view.
Thank you, sir. There is one more question from Dr. Abhishek.
Yes.
So, what is a stress management unit? Do we have a unit for doctors can IMA have it? Number 1, please give examples and explain the emotion-focused coping styles of stress management. Number 3, is social drinking, especially alcohol, is in acceptable individual limits a method of stress management? Number 4, how do we manage collusion thoughts of doctors to take a psychiatrist opinion in stress management?
Can you repeat the
So what
last
is the
question?
stress management unit?
Can you repeat the last
So
question, Prabhakar?
how do we manage the collusion thoughts of doctors to take a psychiatrist opinion in stress management?
So definitely,
Number 1 is, what is a stress management unit?
yeah, definitely stress
Do we have a unit
management
of that?
should be given a prerogative in all IMA units. I think one of the things which has been started by this executive is calling me and asking me to talk on stress management itself is one what the IMA is doing everywhere. I think they should have stress management classes. In fact, as I was telling you, in the present latest medical curriculum also, at the medical level itself, there are now classes being taken by us on communication skills and also on stress managing techniques, which have to be taught from the beginning to the kid. So that type, there is a step made forward, and I think we can have, and also we should allow the doctors who have having stress to freely consult us. See, the stigma still persists partially of consulting a psychiatrist. So that stigma should be removed, and the positive psychology is important here, and so they should be easily coming to the doctor. And we are also doing in the Katuri Medical College, when people are getting admitted in the medicos, getting admitted in the first year as well as in the PG level, we are interviewing them, we are doing administration of scales and finding out few people who need our help, and we are doing it. That can be definitely done there. And as for emotions control, that's what I have dealt in the talk, because of lack of time, fear of exceeding so much. The emotional control should be there, and it should be able to, you should make a lot of people friends, close friends, good friends, with whom you can share. One or two is enough, not 10 or 20. And as I said, who is going to tom about you badly about everybody? It's not that. One or two people, close friends, who wish your betterment is definitely needed. And you have to share with them. Never keep the emotions inside, popped up. Just like a pressure cooker, it would burst out with the burnout syndrome. And third one, regarding social drinking. Any alcohol should not be taken as remedy for stress. That is the first thing. So, social drinking, obviously, on occasions with a group within limits can be done. But again, the social drinkers who have been followed up for a decade, it was found that 25% of the social drinkers have become addicts after a decade. So always you have to be cautious. And social drinking, again, it should be always in company, take with food, take slowly, minimize to one or two packs, and never take alcohol to drown your sorrows. Never take alcohol to remove your stress. If that is the remedy, if that is the Penaka, then lot of stressors, then you take alcohol, and never take alcohol alone, because these are the risk factors that will make social drinkers to become addicts. So that is one important thing which you have to take. I don't say you should not take, you should be abstinent, but if you are drowning your sorrows with alcohol, if you are having schizoid personality, if you are having impulsive personality that is taking risk, then don't go for alcohol. That is my advice. I think there was one more question here, which I can see in the chat box. Role of stress, yoga in stress relaxation. So that is very well proved scientifically. At NIMHANS, Bangalore, there has been a study for the last 3
ఇంకేం లేవు కదా.
So, role of yoga, sir. So, at NIMHANS, there has been a study on these patients on role of yoga. A batch of 50% of the people were taught about yoga and Jacobson relaxation therapy, while other 50% were only given treatment, not any yoga. And it has been clearly proved that yoga is definitely very useful. And again, scientifically also, it has been proved that yoga increases the histamine as well as neuroplasticity, that is increased regeneration of neurons. The concentration itself will give us a lot of help, and that is yoga. I would advise a lot of my patients to do yoga, and if they don't, they can't go for it, they can just practice taking a deep breath and releasing slowly and concentrating on something, avoiding all the external stimuli and sitting in a place. If you are a atheist, if you are a Hindu, think of Om or whatever it is, you can just put that word, and that is going to definitely help. And I would always advise yoga as a stress buster.
Now I request Dr. Hemalatha garu, Treasurer IMA, to put a vote of thanks.
థ్యాంక్ యూ సార్. నేటి వెబినార్ అద్భుతమైన విజయం సాధించిన సందర్భంగా కృతజ్ఞతలు తెలుపుకోవడం గొప్ప గౌరవం అని నేను భావిస్తున్నాను. మా ఆహ్వానాన్ని అంగీకరిస్తూ ఇక్కడ ఉన్న ప్రముఖ ఆహ్వానితులందరికీ ధన్యవాదాలు. మొట్టమొదట మన ప్రత్యేక అతిథి, ప్రముఖ మానసిక వైద్య నిపుణులు, స్నేహశీలి డాక్టర్ కోటా సురేష్ కుమార్ గారికి IMA తరపున హృదయపూర్వక కృతజ్ఞతలు తెలియజేస్తున్నాము. ఎంతో బిజీగా ఉన్నప్పటికీ మనందరి కోసం మన ఆహ్వానం మేరకు వారి అమూల్యమైన సమయాన్ని కేటాయించడమే కాకుండా వెబినార్లో స్పీకర్గా పాల్గొని స్ట్రెస్ మేనేజ్మెంట్ విషయంపై వారి ప్రశంసనీయమైన ప్రసంగం మనకు తెలియజేసినందుకు సార్ మా అందరి తరపున చాలా గౌరవంతో మీకు హృదయపూర్వక ధన్యవాదాలు మరొకసారి తెలియజేస్తున్నాము. మా అన్ని ప్రయత్నాలలో వారి విలువైన సహకారం, మార్గదర్శకత్వం మరియు ప్రోత్సాహాన్ని అందించి ఈ సందర్భం చిరస్మరణీయమైన విజయవంతం కావడానికి కృషి చేసిన IMA EC సభ్యులకు మా హృదయపూర్వక ధన్యవాదాలు. అలాగే డాక్టర్స్తో పాటు ఈ వెబినార్ నిర్వహణలో తమ వంతు సహకారం అందించిన మా ప్రియమైన నర్సుల బృందానికి పేరు పేరున IMA తరపున ప్రత్యేకంగా ధన్యవాదాలు తెలియజేస్తున్నాము. ఈ కార్యక్రమం విజయవంతం కావడానికి ప్రధానంగా స్పాన్సర్ చేసి సహకరించిన లైనెక్స్ కంపెనీ ప్రతినిధులకు, యాజమాన్యానికి IMA తరపున ప్రత్యేకంగా ధన్యవాదాలు తెలియజేస్తున్నాము. ఇండియన్ మెడికల్ అసోసియేషన్ అనంతపురం విభాగం చాలా ప్రతిష్టాత్మకమైనది. గతంలో IMA ఆధ్వర్యంలో అనేక కార్యక్రమాలు నిర్వహించిన ఆయా కమిటీల ప్రతినిధులందరికీ హృదయపూర్వక శుభాభినందనలు తెలియజేస్తున్నాము. ప్రస్తుతం IMA నూతన కమిటీ ఆధ్వర్యంలో నిర్వహిస్తున్న శాస్త్రీయ వైద్య విధానాలు, సామాజిక సేవా కార్యక్రమాల్లో మేము సైతం అంటూ కమిటీ సభ్యులు, ప్రతినిధులు, వైద్యులందరూ ముందుకు వచ్చినందుకు, మమ్మల్ని ప్రోత్సహిస్తున్నందుకు అందరికీ ప్రత్యేకంగా ధన్యవాదాలు తెలియజేస్తున్నాం. భవిష్యత్తులో నిర్వహించే IMA కార్యక్రమాలన్నిటినీ గతంలో లాగే ప్రతి ఒక్కరూ అన్ని విధాల సహాయ సహకారాలు అందించాలని విజ్ఞప్తి చేస్తున్నాం. IMA మనందరి కుటుంబం, వైద్య దేవాలయం. IMA అభివృద్ధికి శాయశక్తుల కృషి చేస్తామని హామీ ఇస్తూ మీ అందరి సహకారాన్ని కోరుతూ మరొక్కసారి అందరికీ హృదయపూర్వక ధన్యవాదాలు తెలియజేసుకుంటున్నాము. సెలవు. నమస్తే.
Thank you, madam. So, Dr. Sreenivasulu sir, you want to say something?
Hello. That was an excellent presentation by Dr. Kota Suresh.
Thank you, sir.
He
Thank you.
elaborated every aspect of stress management and spending time with family, relaxation and yoga and communication skills. So that is very nice, very useful. I kudos to the Prabhakar and team. I expect a few more webinars, useful webinars in the future, virtual as well as live, participatory. Thank you.
Thank you, sir. Thank you very much.
Thank you,
Thank you,
sir.
Prabhakar, sir.
Thank you, sir. Thank you, sir. Thanks a lot.
Yeah, thank you very much.
Thank you, sir.
Thank you,
Here
sir.
we close the session. Thank you, one and all.